today there was a lot of news about Natasha Richardson, who suffered a bad brain injury in a relatively trivial skiing accident on a bunny slope. So the question is why? I mean, should we all just stop skiing? Shall we just go on the flat slopes and do cross country and forget any kind of downhill? No, I don't think that's reasonable. I think that people have head injuries all the time. Sometimes a freak head injury occurs with much more damage than would be expected given the type of injury and the circumstances of the injury. But we also have to remember that there are a lot of extenuating circumstances that go into any head injury. But basically, the type of injury we're talking about is a bleed in the head, not necessarily in the brain, but in the head. And within the head, there is, of course, the brain, and then there are three coverings of the brain. And when we talk about blood happening or a bleed occurring in the brain, we have to identify the location as either being in the brain itself. That's called an intraparenchymal hemorrhage into the tissue of the brain itself. That can be caused by trauma. It can be caused by strokes. It can be caused by tumors. It can be caused by aneurysms or vascular malformations. It can be caused by drugs. Cocaine is a particularly notorious player in that regard. Then in terms of hemorrhages which occur in the head, but not in the brain, over the brain, we have to look at the coverings of the brain. And the outermost covering of the brain is called the dura. That's a Latin word for tough. And it's a very, very fibrous, tough membrane which occurs just inside the bone and outside of the brain. So if a hemorrhage occurs inside of the bone but outside of the dura, and that usually happens in conjunction with a skull fracture, then we have an epidural hematoma. And epidural hematomas can be very insidious because the trauma occurs, the patient may or may not black out, and then there's a so-called lucid or lucent interval during which they appear totally normal. And a lot of drunks wind up being discovered dead in jail because they're thrown into the jail thinking they were just drunk, and the next morning, because the hematoma expanded, crushed the brain, and killed the brain, the person is dead. So that's the epidural hematoma. On the other side of that same covering, the dura, can be another type of hemorrhage called a subdural hematoma. And in a situation like this, we would talk about an acute subdural hematoma, as opposed to a chronic subdural hematoma, which is seen in older people as a result of brain atrophy and relatively trivial injuries. But the acute subdural hematoma is due to tearing of the veins which are making their way from the brain to the covering of the brain where the major drainage system is located. So if these veins are ripped by a sudden change in the position of the brain vis-a-vis the skull, then an acute subdural hematoma can occur. Now, the type of injury that causes the acute subdural hematoma, especially in a younger person, is usually a very severe trauma with a lot of twisting of the head or forces applied to the head. So I don't think she had that, although she could have had that. Then inside of the dura is another covering of the brain called the arachnoid. And we talk about hemorrhages, subarachnoid hemorrhages. And these are the hemorrhages which are located in the spinal fluid, which covers the brain within that arachnoid or inner covering. And these usually occur not so much as a result of trauma, although they can, but more likely as a result of a ruptured aneurysm or a blister on one of the blood vessels of the brain. So to recap, from out to in, we have the acute epidural hematoma, usually the result of head injury and not necessarily a very severe head injury, a billy club maybe. The acute subdural hematoma, which is usually associated with a rather severe head injury. A subarachnoid hemorrhage, which is usually the result of bleeding from an aneurysm. And an intraparenchymal hemorrhage, which is often seen as a result of trauma but can be seen in strokes, aneurysms, tumors, as well as trauma. And that's the recap. What do all these hematomas, hemorrhages have in common? Well, what they have in common is this. By taking up space within the head, they are not allowing room for the brain. If you're a woman and become pregnant, your belly expands to allow the fetus to grow without causing any problems whatsoever. But if that occurs within your head, if something is accumulating volume within the head, the skull can't grow it, the skull can't stretch. So what happens is that the pressure within the head goes up. And when the pressure gets high enough, then the blood which is being pumped into the head from the heart can't overcome the pressure. The brain doesn't get any more blood, and the brain dies. So it's increased pressure within the head, increased intracranial pressure, which really causes the problem. The increased intracranial pressure is due to accumulating volume, in this case a blood clot, and the rate at which the volume accumulates will determine how fast the deterioration is going to occur. So a rapidly accumulating blood clot will cause immediate or close to immediate problems. A slowly accumulating clot can actually be quite large before it causes any symptoms at all, and can occur over several days or even several weeks, just like a brain tumor. The faster it grows, the sooner it presents. The slower it grows, the more the brain has the opportunity to accommodate for this mass within the confines, the rigid confines of the skull.